I'm Charlene Aboutanos and we'll be discussing neck lift today. A neck lift procedure is a surgery that is performed in order to improve the contour of the neck. And this mostly involves three main things. The skin is something that we try to make look a little bit tighter, and the platysma muscle is the muscle in the neck that we try to bring together in the middle of the neck to give it a better contour, and that is something that shows under your chin area. And then also try to eliminate some of the excess fat, and this can be done through liposuction. The incisions are typically created behind the chin in a several centimeter type incision, and then there are incisions that most of the time are hidden either behind the ears or around and behind the ears into the hairline. We usually like to camouflage these so that they're not very visible from the front view and also from the side view, and we also take into consideration how the patient wears her hair or his hair so that they're not noticeable when the patient has their hair up in a ponytail or in a braid. Usually there are a couple stitches that are placed, and those are usually in for about a week, and then they are removed approximately a week to 10 days later in the office, and that usually doesn't take longer than 15 minutes. Usually I like to place a lot of numbing medicine in order to give the patient relief post-operatively in the first couple hours of the procedure, and then into the next day or two there may be some swelling that we like to control with a dressing that goes around the chin and over the head sometimes. It depends on the patient. And then usually there is swelling or bruising that can last up to 2 weeks or longer, but we get through this with regular visits in the office in that first time period. So a neck lift can also be combined with a facelift and other procedures. Sometimes people are not interested in having surgery or anesthesia for improving the contour of their neck, so I usually discuss with them the options of injecting Kybella, which is an injectable procedure that happens in the office. It does take about 30 minutes, and it can be repeated 1 or 2 more times after the initial injection, and that really just targets the extra fat that is deposited under the chin, which a lot of people have even from when they were younger, and also that they've inherited from their family members. The other options for improving the appearance of the neck skin is laser resurfacing, which can eliminate some of the sun damage and sometimes also tighten a little bit of the skin in that area and just make it look a little bit more youthful. The other option we have here is something called Profound, which also works not only on tightening the skin, but we can also work on removing excess fat, and that is usually a permanent fat destruction too. All in all, there are several options for improving neck contour.